It's really a pleasure for me to be here, and I wanted to thank the organizers for giving me this opportunity. And I also want to just mention that Jyoti has been a critical part of all of this body of work. And he's also my co-PI on some of the work that I would be presenting today. So it's really exciting to be here. So let me quickly share my screen, and then we can just get started. So a lot of you may already be aware of the graduation approach because, like Jyoti said, it has been receiving a lot of attention, international as well as in our country as well. But I thought it'd be really good to just take us back, and for of you who may not be of this approach, to also really explain to you what the graduation approach is and what is the problem that it really tries to solve. So for this, for us to again just look into the context of India and also think about other low and middle income countries. So while all of progress, we also know that it has not been inclusive in nature. And we know that there are a lot of inequalities that persist, whether they're economic or social in nature. The benefits of this economic progress have really accrued only to a very small section of the society. The other thing to really keep in mind is that poverty is not a homogeneous group. And within poverty also, there is the group of extreme poor, those who are really not even able to take advantage of the existing social protection systems be there. You know, almost very marginalized, and they are kind of cut off. Even so this is the particular program really targets. And in India, it's when we get the SEC data, and while the definition of $2 a day, we have depreciation criteria in SEC data. And if we look at that, we find that still 9 million households into this category. So what this means for us is that ultra poverty is a problem, and this is something that may not be getting addressed by the existing anti-poverty programs. So basically the point I'm trying to make is that even when we have programs like the Rural Livelihoods Mission, and there is a lot of there are many of these self-help groups, the ultra poor are not even able to manage to save 20 rupees a week, which is a requirement to be really an active member of these SHGs. So as you can see, there are unique needs that this group of people have, and the graduation approach was designed to really meet the needs of these people. So what is this graduation approach? The whole idea is that these people who are in the ultra poor category are stuck in a poverty trap, and they need a big push to come out of this poverty trap. So what the whole idea is that there is a sequence of support that is provided to these households for a specific time, which is mostly 2 years, right? So it's almost like 18 months once they get the asset. And the different components of the graduation approach include, first of all, a very focused effort on targeting to ensure we get the right people. And again, this is very important to note because these people are marginalized, they are almost invisible. So it's really important to get the communities together to identify who the poorest of the poor in that specific village may be, or in that specific block. So there is a participatory identification which is undertaken, after which there is a transfer of an asset that is made, and the asset could be livestock or the asset could be an enterprise. Many times this is done through a micro planning process where the needs of those households are also taken into account, as well as whether it would make sense with respect to what is already existing. Then there is also enterprise skills training, which is provided to these households. And again, these are usually women-headed households. But for example, in Bihar, the categories, the eligibility criteria is a little bit more open. They're also given temporary consumption allowance so that they don't have to worry about going out to earn money while they are, having these coaching and mentoring. And then they're encouraged to have savings. They're also provided weekly mentoring, which is extremely important, how to keep a book of records, how to negotiate in markets, etc. And they're also provided with information on health and education. Now, this approach was pioneered by BRAC in Bangladesh, and they had a long history of implementing this approach and focusing on the ultra poor households. And the idea is that after 2 years, these ultra poor households are able to shift from extreme poverty to more sustainable livelihoods. So in a way, this graduation approach provides pathways for these households to move out of extreme poverty. And there are these 12 graduation indicators. And if the household has met 9 of them, then it basically means that they have successfully sort of graduated. It doesn't mean that they are suddenly economically very well off, but what it means that they are now at the next threshold where they can access the existing social protection systems that the government has. They can have some bit of savings and things like that. So moving on, one thing I wanted to really emphasize is that when this program started, BRAC had been doing a lot of work to assess the impact of this program. And they even did a randomized evaluation, and they found that yes, the program was having huge impacts in terms of the economic well-being, including consumption, income, savings, but also across a range of other social indicators. But then the question was that would these impacts, also happen if this was implemented by an organization other than BRAC, if these were implemented in a different context, and secondly, do the impacts also sustain over time? So we now have answers to both the questions. So from the generalizability perspective, this program was implemented in 6 countries, and there was a 6-country study where randomized evaluations were undertaken by some great researchers across these different countries. And what we found, there were the pooled results of these efforts, which were then published in a paper in Science, which clearly showed the impacts of the graduation approach, even when implemented by other organizations. We did find these very similar impacts, and there were 2 end lines. One was immediately after the program ended, and the other was 1 year after this end line. And what we also found was that like BRAC had provided training to these NGOs. So there were visits that happened by these NGOs to Bangladesh and from BRAC staff to these countries to provide very good trainings. But then the programs are actually implemented directly by these different NGOs in these different countries. Now to the question of whether these impacts actually last, what we find is that the study was conducted in India, in West Bengal, and Abhijit Banerjee and Esther Duflo, along with co-authors, had done a randomized evaluation around it. And they continue to follow the cohort of this particular initial program. And just recently, they have published this paper on the long-term impacts. And what we find is that the impacts are persisting. So I will speak a little bit about this in the next slide. And what we are seeing is that there are also many of these other indicators where what this graph is showing is that those in the treatment households are this many % more likely to have these outcomes as compared to those in the control group. And the reasons for this long-term persistence is that there were, of course, early economic gains that they were able to manage by diversifying the economic activities. But what we are finding the later on, they are also able to kind of have more migration, for example, and they're getting more income from remittances, which could be because even to be able to use the opportunity to migrate to find work, you need to have some upfront investment, which the ultra poor households may not have had. And now the treatment households may have this particular opportunity and ability to take advantage of this aspirational migration, go out and work, and thereby have increased incomes. So this is something that's really important to keep in mind. Now I'm going to switch gears a little bit to also talk a little bit about how we then J-PAL focused on then trying to use the results from this work to try and see whether governments in different states in India that are still having this problem of ultra poverty, can they, include this particular program as a part of their social protection program. So we began our journey early on in 2007, and it took a lot of effort. It took many different meetings. And one of the questions that the governments often asked were that, well, this may have worked in West Bengal, but we are not sure if it's going to work here. So even when you have results from very rigorous findings, it is important to do these demonstration pilots or policy pilots where you can take the officials and you can show to them. So in Bihar, we did one pilot which was implemented by Bandhan Konagar, who is our core partner for this for the implementation of this approach in India. And then we did another policy pilot that was implemented by Jivika, which is the which is a government body that's been implementing the program Jivika. And then in 2018, the government of Bihar decided to scale this up. So I'll talk a little bit more about this. Um, and so we have been working across different states, and the governments have been willing to invest in this. Initially there was a resistance because they said we have invested into a loan-based model, which is the whole self-help group model, whereas this is a grant-based model. But very soon they also started acknowledging that even the self-help group model is not reaching the poorest of the poor. And so we are seeing these different state governments buying into this idea. But the biggest breakthrough for us happened when the government of Bihar announced a scale up of this program to reach 100,000 households, and they launched the SJY program. And they are currently, they have really almost identified about 70,000 households. And now J-PAL South Asia is working with them as a knowledge and learning partner. So one, of course, there is a randomized evaluation component here because this is the first time the government is implementing this program. So we need to know that, what is the impact as we move from an NGO implemented model to the government implemented model. And Bandhan Konagar is providing the technical assistance for implementation, but we're also doing a very deep process evaluation where we're actually unpacking the different levels of the model, because it's a very complex program having many different stages, and trying to provide feedback to the government directly on how the adaptation of the model is working. And of course, it's not possible to just adapt the model as is when you want to reach so much scale. So the government has also been making its own tweaks, and our process evaluation is directly informing some of this. So now I would say that, these are just, I'm not going to go very into too many details, but this is just sort of a very quick snapshot of some of the things that we are finding from our process evaluation, where we are directly collecting data from the beneficiaries. We are doing back checks. We are doing observations of the different trainings. We are using different types of tools for this process, and how this is then also leading for Jivika to take different types of action to course correct. Now I wanted to just say that when the pandemic hit and then there was a lockdown which was announced, it of course created a lot of questions as to what will now happen to this particular group. So J-PAL decided to undertake a study, a very quick sort of a descriptive survey using telephonic interviewing. And what we did was that there were two objectives of this particular work. So first was to assess the reach of Jivika's activities. So soon after the lockdown was announced, Jivika decided to push, to transfer rupees 2,000 stipend for the SJY beneficiaries so that they had this money. They also used IVR to provide more information to the SJY beneficiaries in SHG households. And we personally also wanted to say that how were these households affected by COVID-19 across these four dimensions of health knowledge, income shock and coping strategies, food security and knowledge, and access to different social protection schemes. So we undertook this particular survey, where we also had SHG households to serve as a very quick control or a comparison group for us. And then we had these telephonic surveys. And what we found was that overall the health knowledge in terms of hearing about COVID-19 was high, but they were really not able to recall, even one symptom of COVID-19. So this was something that we then were able to inform the government that they need to continue to make these efforts around awareness generation about the pandemic and the preventive health behaviors that may be needed. We also found that those who had an enterprise by the time the lockdown was announced, they continue to run the enterprise, but of course they reported much lower sales. We also found that a lot of the households ended up spending a lot of their savings that they may have accrued from these enterprises before the pandemic period on their consumption needs, which again is something that is bound to happen. And finally, we also find that the SJY households had to resort to some of these, to these coping strategies, such as reducing the number and size of their meals. So this was sort of a problem that we were able to identify through our survey. And finally, I think it was really important that while the government was pushing a lot of relief measures, it was important to know whether our SJY beneficiaries were being able to access these relief measures. So we also, our survey also looked into this. So overall, the conclusion from the study was that the graduation approach offers an economic inclusion pathway to help households build resilience in crisis. And what to me this really means is that, these households are almost sort of invisible. Uh, if the government of Bihar had not made the graduation approach a formal part of their social protection system through the SJY, they would have had no means of getting connected with this group. So through this effort, they were able to identify who the poorest of the poor are, open bank accounts for them, have a direct link with them that they could then use to push a range of relief measures. And of course, the self-employment approach also bolsters the household's ability to deal with economic shocks. So those are some of the two main things that for us are like important takeaways, because of course the graduation approach in and of itself has been found to be extremely effective overall. But we also find that in case of extreme crisis, it can have further advantages. So now I'm going to just quickly move into the next segment where I wanted to talk a little bit about J-PAL South Asia's COVID-19 related research work, and then end with a particular work that we had done, early in the phase. So firstly, as soon as,
Shagun,
yeah,
I'm sorry to interject in the interest of time, because we would also like to have some Q&A.
yeah.
If you can spend about 5 minutes or so to talk about the COVID-19 results, and then we can take some questions.
Sure, Jyoti. So I'll just wrap up in the next 5 minutes. Okay.
Sure.
So basically what we did was that we undertook some new research, but we also expanded on our existing projects. And what this means is that since J-PAL had a few projects, we were able to use the sampling frame of that project to then undertake more COVID-19 related surveys using telephonic means. And these are the broad topics on which our research focused. And 64% of our work was with government partners. Uh, the themes that we studied are as follows, and we also did a very quick mapping to see how these were mapping onto the work that other organizations similar to J-PAL were doing in India. And again, as you can see, that there are many themes in which sort of J-PAL is working along with many other organizations. And so this is also the idea is how we can all, come together to share our findings and pool the work that we are doing. Finally, I wanted to just end by talking a little bit about this particular piece of work, which was done by Esther Duflo, Abhijit Banerjee, and other J-PAL affiliated researchers early on to basically understand that as the government is pushing out so many different types of communication, the main question was that does light touch messaging by a credible individual improve health-seeking behavior? And here what we did was we sent messages to 25 million individuals. This was an SMS with a 2.5-minute clip, which was delivered by Abhijit Banerjee, who is a celebrity in West Bengal after his Nobel win. And what we found that the results were very exciting, because what we found was that there was double the reporting of health systems to the community health workers for the COVID-19 symptoms. We also found that there was decreased travel beyond one's village. And there was also spillovers to other types of behaviors that were not directly alluded to in the message, such as wearing a mask. So this is again very important, because although there has been some work, that has, looked into this celebrity messaging or messages by a credible individual, there was an open question whether something like this would work in a context or in when you have a pandemic like situation. So this is something that we were able to do. I would like to now end here, and Jyoti, over to you for the Q&A session.
Thank you very much, Shagun, for the insightful presentation. We have a couple of questions. So the first question is about the impact of this particular COVID pandemic on the ultra poor households. Is there any differential impact in terms of who gets, job opportunity, the opportunity to work under NAREGA and those who don't get an opportunity? So did you find any differential impact?
So we actually didn't look at this specific question. So in our survey, we had not really looked at just specifically NAREGA. We were more interested in seeing whether the households were able to access the relief measures, whether they had enough information. So unfortunately, this was something that we didn't see with respect to NAREGA participation.
Okay. The other question that I can see here is about the impact of this COVID pandemic, especially for the ultra poor households in terms of the educational outcomes. Did you see any significant impact on their educational outcomes?
So again, I mean, this would have been really great if we could have captured this, but, we are also limited in telephonic surveys. The length has to be sort of really short, so our survey really focused on some very core and critical things that have a direct impact on the well-being. And of course, education is very important, but we didn't really include a question on education in our surveys as well.
Yeah. And so I'm just curious, how difficult it was for you to reach out to the beneficiaries, especially during the pandemic, in terms of, conducting the surveys over phone.
Yes. So actually we were, so we were actually very surprised that the response rate was quite high, and the phone numbers were of course provided to us by Jeevika. And again, one of the questions that people almost always have is that, how can these ultra poor households have access to phones? But even in our baseline work that we had done, we found that almost 40 to 70% of households have access to phones. And they were also willing to talk, and they were willing to provide us with answers. So, we were also very surprised because initially we weren't sure whether, we would get this kind of a response.
Yeah.
So that was good.
Okay. See, are there any questions which remained unanswered? No. Okay. So thank you once again, Shagun, for joining us in this event, and thanks to all the participants. So with this, we have come to the end of this session, and it's over to
Jyoti,
you.
if there is time, may I ask a question, Jyoti, please?
Sure. Why not?
There is time.
Yeah, please go ahead.
Do we have time?
Yeah, we
because,
have.
I belong to this ultra non-privileged category where I can't type a question because I'm the co-host. I have to ask it audio video. Sorry about that. Just a very simple question on the generalization that you mentioned across countries. I was just curious, because India is very unique in another way, in addition to the ultra poverty, while gender may be something that is a further factor which complicates the problems of the ultra poor, we also have another form of hierarchy, which is not there in, say, Africa or South America, which I know I'm alluding to, right? So to what extent does caste play a role in the benefits that come out of your graduation program?
No, that's a very, very good question, Professor Kadam. And I think the way I would like to answer this is to say that it's precisely for this reason that it's important to have targeted programs like graduation approach, because, again, there may not be very strong evidence on this right now, but what we understand is that even with the SHG group, there could be a caste dynamic that plays where a lot of these ultra poor households also belong to low castes, right? So they are not able to there are these power dynamics which can then interfere in their own participation. So this with the ultra poor program really finds a way to bring out these people and also connect them with the broader community. So in a way, the overall communication from Jeevika has also been that adopt these households, help them, so we are also trying to get that participation from the community lens, which may not have existed because of the caste considerations. Now, in terms of generalizability, again, the beauty of this program is that by design, it has a lot of things where it takes this community element into account. So starting from the way you target these households and identify who they are, to all the way of what type of asset you give them, you are taking into account you're doing things like micro planning. And so you are really designing this program with all of these thoughts in mind, which is why it is successful in other different contexts as well. So I hope this answers your question.
Yes, it does. Thank you.
Thanks.
Thank you very much, Shagun. Thanks to all the participants. With this, now we can close the session and we'll move on to the next session. Over to you, Ashay.
Bye, everyone. Thank you.
Thank you.